Hi, this is Diane Carbo, RN with caregiverrelief.com. Today's topic is dementia hereditary. That's a question that I get asked very often, especially after a newly diagnosed family member has been diagnosed with a form of dementia. I can tell you right now that the answer is going to depend on the type of dementia, your genetics, how you live, your environmental and your lifestyle choices. So, lifestyle factors also play a part in whether you're going to develop dementia or not. Multiple factors can lead to the development. These factors include advancing age, family history, cardiovascular disease, and even the history of a head trauma. Most forms of dementia have multiple risk factors, with genetics playing only one part. Let's discuss Alzheimer's disease. It accounts for 60 to 80% of all dementia cases in the world. It is caused by a mixture of your genes, environmental, and lifestyle choices and factors. Certain genetic variants can increase the risk of developing dementia. Genetic variants are genes that determine traits like our hair color, but exist in different forms. I'm blonde and with blue eyes. Blue eyes is the recessive gene. My brother and sisters are brown hair and brown eyes. Gene variants, in other words, are functional genes. They're not abnormal and they're not mutated. Possessing certain gene variants can increase the risk of dementia. However, it depends on the gene's interaction with certain environmental, how or where you live, and lifestyle factors, how you eat, how you respond to stress. Do you drink? Those types of things. Smoke, do drugs. Those all contribute to the prevention or the development of dementia. So in this way, dementia and having the hereditary factor are related in some ways. I'm going to discuss a familial dementia, which refers to cases where the dementia is caused by an inheritance of genes passed down from your parents. It's important to note here that having a single copy of any one of these, and these are genetic mutations, is enough to develop this form of familial dementia, which I'm going to address a little later on in our program here. In other cases, receiving a genetic variant, not a mutation, a variant from both parents is necessary for developing a form of dementia. Now, most forms of familial dementia develop between the ages of 30 to 65 and are referred to as early onset dementia. Genetic testing for dementia should be considered to assess any individual's risk when they have a blood relative diagnosed with dementia. But many fear having that genetic testing done because with the absence of a cure, it only causes them anxiety and emotional distress. That's when I recommend that you seek counseling before you get tested, but I strongly recommend you get tested because no matter what, environmental and lifestyle choices can really make a difference. So let's focus on Alzheimer's disease. Alzheimer's disease is the most common form of dementia. Age, rather than genetics, is the Alzheimer's disease's biggest factor. That risk doubles every 5 years after 65 years of age. I find the results of one study fascinating, as my dad was a twin. A study done on twins found that if one has Alzheimer's disease, the other twin only has a 40 to 50% chance of developing Alzheimer's. This shows there is a significant role played by environmental factors and lifestyle choices. My dad didn't have dementia, neither did my uncle. No, his mother did. My grandma Smith had Alzheimer's. But I wanted to share with you that this also, environmental factors and lifestyle choices also play a role in other diseases. My dad was a twin, and they were both in the Navy, both my uncles. Long story short, one smoked, my dad, for many years. He quit 20 years prior to his death, and my uncle never smoked. The thing with my dad is he developed pancreatic cancer in his early 70s and subsequently died from pancreatic cancer, which is a secondary site for many smokers, even though he stopped smoking 20 years prior. And my uncle, my dad's twin, lived to a ripe old age in his early 90s. So, although a close family member can suffer from dementia, increases the risk in your relatives, Alzheimer's is not usually inherited by the next generation. And I can see that in my dad's family. My grandmother had dementia. She lived to be 98, I believe. My grandmother's sons never developed dementia. But now myself and my siblings and my cousins are all have the risk and possibility of developing dementia, an Alzheimer's form of dementia, because we obviously have certain genes that may increase for development of it. I want to just touch base on early onset familial Alzheimer's disease. This is a familial form of Alzheimer's disease. It develops between the ages of 30 to 60, as I had mentioned before. And there are 3 mutations in 3 different genes that have been identified as being responsible for early onset familial Alzheimer's disease. If you have somebody who has developed that in the past, then it's really good to know because it's a chance that you might develop that as well. Let's discuss vascular dementia. Vascular dementia is not inherited in any way, shape, or form. Now, lifestyle factors play an important role in preventing this development of this dementia. Vascular dementia is caused by damage to blood vessels in the brain, resulting in a stroke. The risk factors for developing vascular dementia are same as the risk factors for developing a stroke, high blood pressure, atherosclerosis, which is the disease of the blood vessels, and diabetes. These risk factors show that vascular dementia is only genetic to a point. Here's what I mean. Genes that increase the risk of developing any of these medical conditions, such as high blood pressure, high cholesterol, diabetes, are likely to increase the risk of developing vascular dementia. This is the most preventable type of dementia, and I can tell you that with modern medicine, everybody talking about the Mediterranean diet and managing your blood pressure and stress, we've seen a decrease incidence vascular dementia occurring, which is a good thing. Now, here's a question I have. Did you know that Lewy body dementia is the second most common type of dementia? Lewy body dementia is also the most undiagnosed of all the dementias. It's been around for a century, or at least the awareness of it, but it lacks substantial data regarding the hereditary nature of this dementia. Lewy body dementia genetic factors have not been fully characterized to this present time. It is believed that only a small number, about 10% of cases of Lewy body dementia, are hereditary. Like Alzheimer's disease, a family history of Lewy body dementia can increase the risk for developing the disease. For example, the siblings of Lewy body dementia patients have twice the risk of developing dementia, meaning if you have a brother or sister that has been diagnosed with Lewy body dementia, you have twice the risk of developing it as well. Let's discuss frontotemporal dementia, FTD, is a type of dementia involving cell degeneration in the frontal and temporal lobes of the brain. I wanted to explain here that your frontal lobe is where your executive function is. That's your filtering system. So you may think something like, oh my God, that person's, but you have the wherewithal not to say it because that filter says, nope, don't say that. But those with frontal involvement, they lose that filter. So instead of saying and not thinking it, they're going to just come right out and say, God, you are one fat lady. It's not intentional. It's not anything they can control. And it's a very challenging dementia because temporal lobe of the brain is where your emotions are. So if you be irritable, cranky, quick to change emotions, or become angry right away, it's frontotemporal dementia. And it's one of the leading causes of early onset dementia. Only 25% of all frontotemporal dementia cases are late onset. But is frontotemporal dementia hereditary? It is hereditary in about half of the cases. It has been found that the mutations in 5 genes are responsible for familial frontotemporal dementia. The inheritance of these genes can lead to this form of dementia in all cases. This means frontotemporal dementia is definitely genetic and inherited. There are cases where major risk factors of FTD are caused by trauma and thyroid disease, but it's not as common as you would think. So let's talk about the elephant in the room. You have a family history of dementia. Individuals with a family history of dementia may be at higher risk for developing dementia. This may be due to the inheritance of those genetic variants that increase susceptibility rather than causing it directly. In such cases, chances of getting dementia are also influenced by your lifestyle choices and the environmental factors, such as where you live. So if you have a history of familial dementia, genetic testing is going to be very useful for you. Such genetic testing is available for genes involved in Alzheimer's disease, the 3 genes, and frontotemporal dementia, there's 6 genes. Remember, knowledge is power. If you know that you are genetically predisposed to a form of dementia, you can be vigilant about the signs and symptoms of dementia. You can develop an increased awareness about all available tests, new or advanced treatments. And also, there are no cures available for dementia. You may want to participate in ongoing clinical trials. So, how do you reduce the risk of developing dementia? While heredity can increase the risk of developing dementia, but it does not cause it in most cases. There are multiple risk factors associated with dementia: heart disease, diabetes, smoking, extensive over drinking. With good lifestyle choices, these can be managed and help to prevent dementia. Maintaining a healthy lifestyle with physical exercise, a balanced diet, drinking alcohol in moderation, and abstinence from smoking can help in reducing the risk of developing any type of dementia. I would also like to note here that individuals with substance abuse disorders are often at increased risk for developing dementia. And I always worry about my family members providing care for somebody with dementia because so many of them turn to substances or food when they deal with stress or caring for their loved one. This predisposes them to dementia. It does have a big concern for me. The next lesson I'm going to touch base on is what are the stages of dementia, and that will be my next lesson. For now, my name is Diane Carbo, RN. I'm with caregiverrelief.com. And for those of you that are family caregivers, please know you are the most important part of the caregiving equation. Without you, it all falls apart. So please practice self-management, practice self-care, be good to yourself, be gentle because you are worth it.
Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.